Appraisal and self-definition of childhood sexual experiences. I mentioned that. This is really important. We need to understand how people contextualize, how they frame their experiences, because it may play a part, may play a role in what they're doing today. So attention to the associations between appraisal and early sexual experiences and adult physical and sexual abuse is needed when we start talking about interventions. And now I'd like to talk a little bit about the enhanced sexual health intervention for men. This is an intervention that we've had out in the field for 3 years, and I'm going to be presenting on just the baseline data. This is an HIV risk reduction intervention for non-gay identifying, HIV positive, Black, bisexual men with histories of CSA. When I talk about this, the first thing that comes to many people's mind is, wow, that's a really specific intervention, and it is specific. But the fact that there are many men who fit this criteria really calls into question the need for providing services for men who have specific issues or challenges. We do need to develop specialized programs. So this was a randomized control study. Men who entered the study were either given the enhanced sexual health intervention or they were given a health promotion. And the health promotion was another intervention where they were provided significant health information which did not focus on sex, but because these were positive men, focused on medical adherence, focused on the need for proper rest, exercise, nutrition, health maintenance. So it was very useful information. Both curriculums involved 6 two-hour group sessions, and they were executed over 3 weeks by a Black male facilitator. The curriculum focused on the triple minority status, being Black, being bisexual, and being positive. There was an emphasis on these early sexual experiences. And so some of the things that the curriculum focused on was providing relaxation exercises, coping strategies, critical thinking, and problem solving. This was a really important part of the curriculum because whenever you address something that is problematic, something that is unhealthy, you don't want to take that away before you give people something helpful, something positive. So when we talk about behavior change, make sure you're giving them the skills to improve themselves before you change their lives and cause this upheaval, right? We did role plays, we did interactive activities. It was for a curriculum that focused on heavy subjects. It was an enjoyable curriculum. And again, we created this environment where the men in the group were able to define for themselves the language, the dialogue, and the community for them. So who were the men? These were HIV positive Black men who had histories of early sexual contact before the age of 18, had engaged in unprotected sex with both men and women in the previous 3 months, so they were behaviorally bisexual, and they did not identify with the gay label. So we're talking about men who are not identified with what is perceived as gay. So here in Los Angeles, we constantly hear, you know, I'm not West Hollywood gay. So when they think of gay, they think of that community. So who was in the study? We had a sample of 117 men, mean age of 46, but you can see our range went from 24 to 67. You can see that this was a vulnerable population. A quarter of the population made less than $7,500 a year. 2/3 of the population, $15,000 a year. High school educated, and when we look at work situation, only 15% was employed in any way. Half of the sample was unemployed, and then we had 20% unemployed, with 10% either being retired or in school. Our marital status. We had 75% never married, but 25% having been married either currently or in the past. Sexual partners in the past 3 months. Remember, the study required that these men have both male and female partners. The mean number of partners, sexual partners, 3.2. The majority, almost half the sample, had two partners, and what we see is most of the men had one male partner and one female partner. Again, the time frame is 3 months. This is where, when we start looking at statistics, it's important to really look at your data, because if you just look at the means, you see 1.8 male partners, 1.4 female partners. You know, that may not cause anyone to really blink. But when you look at, okay, we got 61%, 73% with one male and one female partner, but then we have the other percent where we start to get higher numbers of male partners. It's a minority, but it's still important to see this, to understand what it means. Let's look at what these men are doing. Remember, these are HIV positive men, and we see actually high risk-taking, sexual risk-taking behavior. Unprotected vaginal sex, 69, almost 70%, and the mean number of times in the last 3 months, almost 4 times. Performing oral sex without a condom, 63%, 4.5 times. Again, a lot of men will say, well, a lot of people will say, well, oral sex is lower risk. Lower risk for HIV, but remember there's other STDs out there. Receptive anal sex, unprotected. 44% of the sample reported this, and mean number of times 4.4. Insertive anal sex, again, positive men engaging in unprotected sex. We have 45% with the mean number of times 5.6. Performing oral anal sex, 43% without a barrier, dental dam. And then 20%, a fifth of the population, exchanged sex for money or drugs. Mean number of times, 6.1 times in the past 3 months. So we have a fifth of the population who is very vulnerable. When we look at substances, it's an interesting display. Alcohol, marijuana, cocaine, we see the ever used pretty high. When we start looking at the how often, we also have some significant numbers. Alcohol, daily alcohol use, 12%. Marijuana, a quarter of the sample reporting daily marijuana use. For cocaine, amphetamines, sedatives, not as much. But look at the sedatives. One of the things I did not do, and I was actually surprised at this finding, was finding out whether the sedatives were prescriptive. So we have a third of the population on anti-anxiety meds, on sleep meds. That's what these are. So we don't know if these are prescriptive medications. It's possible. Okay, hallucinogens, opioids, and IV drugs. We see lower numbers. As I mentioned, IV drug use, very low in Los Angeles, but still it's important to understand what your sample is doing. Okay, let's look at the sexual experiences. Age of the first oral anal sex with a male, 17 years of age. Again, this is where many people say, well, that's not bad. But who are they having sex with? The male perpetrator is 23 years old. That's a 6-year age difference. So we have to really understand this. We are talking about a clear power differential. We're talking about a teenager and a young adult. When we look at sex with a woman, a female partner, we see the age of the man being younger, the boy being 15, and the age of the female partner also being younger, but still almost a 5-year difference. So female perpetrators, we have to remember, when we think about sexual abuse, we always tend to think of male perpetrators, but females can also abuse male children and adolescents. Sex before 18 with someone 5 years older. 80% of these men reported having had sex with someone 5 years older than them. This is not consensual. Before the age of 18, let's look at some of the behaviors. These stats really speak to these experiences as being sexual abuse. Forced to perform oral sex, 41% of the population. Forced to receive oral sex, 51%. Attempted rape, 44%. And accomplished rape. These were men who were raped as children, with the youngest age it happening being less than 12. We're talking about grade school, possibly middle school children. So again, this is not consensual. This is childhood sexual abuse. We have 74% of the population reporting the perpetrators as male and 68%, almost equal, being female perpetrators. So one of the things that gets lost many times when we just look at the quantitative results is the story. Who are these people? Who are the men in the study? So I'd like to include a couple of qualitative excerpts because I think they're very powerful and they speak to some of the challenges these men are facing. I was 9 years old and my babysitter forced me to do things. I really believe that is the reason why I do not like women. I try to be straight, but I don't like the way it feels. I feel safer with men. A lot of men don't say things like this, but because we're supposed to be strong and make the woman feel safe, but what about us? So this came from a participant who was trying to have a heterosexual lifestyle. So he was trying to have relationships with women because that was what was expected of him. But each time he had an intimate relationship, he was essentially describing flashbacks.